Hello, everyone. Welcome to our WTF What the Flu webinar. We are going to be going through a lot of great details today, all of it very relevant for the 2019-2020 influenza program. This is Ontario and Alberta focused, so just keep that in mind. But we have a lot of great content, and we're going to walk through a bit of influenza in Canada, what it looks like this year, and go through some of the special changes that have been made with respect to this year's flu season. And then we're going to look at the differences between Ontario and Alberta, look at whole health flu program, including virtual reality. So let's get right into it. We're going to start with influenza.
So this year in Australia, it looks like they had quite a bad flu season. So where they usually get about 1,900 cases reported in the June timeframe, this year they actually found about 31,000 cases of influenza that were confirmed. And so this is in addition to cases that would not have been confirmed through lab testing. So we saw a really big rise, and typically what is seen in Australia tends to predict what we're going to see in the Northern Hemisphere. So experts, as you can see on these slides, are anticipating it to be quite a bad flu season and an early flu season. And that's especially kind of worrisome with some delays that have come this year in influenza vaccine production as well as distribution.
Great. And if we look at this website, it's called FluWatch. This is a really good resource for the national surveillance of flu throughout Canada in terms of its flu spread and flu-like illnesses, and it's posted, the updates are posted every Friday. So it's really nice to monitor what's going on. For example, influenza A continues to be the most common influenza virus circulating in Canada, most regions in Canada have no influenza activity, although there are several sporadic activity in Western Canada. So it's really good to monitor that. You'll see the changes as the weeks go on, as flu becomes more prevalent. So just keep that in mind if you're ever wanting to know more information about what flu is like across Canada.
And in terms of influenza in Canada, we do know that it's one of the top 10 causes of death in Canada, with about 3,500 deaths occurring annually and over 12,000 hospitalizations. And this is especially of concern in patients who have chronic comorbidities, things like heart disease, diabetes, or asthma or COPD, as well as those at the extremes of age, so less than 2 years old as well as over 65 years old. And now typically the influenza season starts in about October, and we see peaks in the January and February timeframe, with it lasting all the way until the end of April. So if people haven't been vaccinated, even in February and March, there's still benefit from being vaccinated until the end of April.
And what's really important, and you'll see a lot of news articles, is about some of the populations that sometimes get overlooked, including those pregnant women. You'll see a lot of cases and a lot of news articles that are encouraging pregnant women to get vaccinated, especially early on in the flu season. And it's also a good time to remind your patients about the other vaccines that would benefit them. Including any of the immunizations that we've discussed, such as the pneumonia vaccination and even pertussis for pregnant women, things like that, that are quite important to also discuss while you have them during this time.
And that can be even really helpful if you don't yet have your influenza vaccines and someone's coming in who might have risk factors for influenza but you don't have the vaccine, having that conversation about maybe getting their pneumonia vaccine if they also have risk factors for that while they're waiting to get their flu vaccine, since we know a complication of the flu can be pneumonia later on.
So if we look at the influenza vaccines that are going to be available for this year, the ones that you may have seen in the past, such as FluMist and FluZone, they're not available in pharmacy. So you will find FluZone high dose in, for example, physician offices, but not in pharmacy. What is available in pharmacy are the 3 vaccines shown on the slide here: FluLaval Tetra, FluZone Quadrivalent, and Afluria Tetra. These are all quadrivalent vaccines, The first two, FluLaval and FluZone, are multi-dosed, and Afluria come in pre-filled syringes. This is a new one, and it's only available in Ontario, so not applicable in Alberta. But keep these three vaccines in mind. The first two will become available this month, and then Afluria will become available at the beginning of November.
And because the FluLaval and the FluZone quadrivalent are multi-dose vials, it means that you'll want to stock other injection supplies like syringes that you'll need for administration of the vaccine. And so on our partners portal, we'll have information on what the order codes and the prices are for these products. And just email us if you have any issues ordering them through your regular supplier.
Now, a common question you might get is, how do we compare, and what if our patients ask us about the high-dose vaccine, which, as we mentioned, is not available in pharmacy, versus the standard dose vaccine, which you are going to have in your pharmacies. So there's one big difference, well, there's a few differences, but the main one between the high dose and the standard dose that the pharmacy has is that the high dose vaccine is a trivalent vaccine. It does contain 4 times the antigen as the trivalent vaccine, but the standard dose quadrivalent is quadrivalent, and so it has that additional B strain. There have been studies to show the difference between high-dose trivalent versus standard dose trivalent, but there are no studies that compare high-dose trivalent versus standard dose quadrivalent. So that's important because if your patients ask you which one is better, well, there's no evidence to suggest that one is more efficacious than the other. So that being said, your patients who are 65 years of age and older will still benefit from the standard dose quadrivalent vaccine.
Yeah, and I would say as a pharmacist, it's our responsibility to let patients know of their option. If they do want to get a high-dose trivalent, that's something they can get from their primary care provider or in a long-term care home. But explaining to them the benefits from the standard dose quadrivalent and that it's better to get vaccinated with something rather than not getting vaccinated if they're not going to be able to see someone like a primary care provider. We do have one question that came in, and it asked about why there was a delay in Canada this year in terms of getting the vaccines, especially because in the States they do have flu vaccines already.
So the reason for that is because there's a couple of reasons why the flu vaccine in general are delayed, and it's because the WHO released the strains of what would be covered later than they usually do. Specifically, there was an additional B strain, I believe that was released March 21st, which is quite late. And then once that information comes available, then the manufacturers need to take their time to develop and do all their safety checks. So that's one reason for the delay. But another reason, and this may come into effect for Canada and our province specifically, is the change in distribution. And we're going to talk about that in more detail as we go along. But as you know, you may have noticed, for those of you outside of the M postal code who don't use McKesson, you will be receiving your flu vaccines from this wholesaler moving forward. So all of those details needed to be ironed out.
Okay. So the last thing we want to cover about influenza in general and administering vaccines is anaphylaxis following immunization. So as we know, there's the adverse event following immunization reporting form that should be completed and submitted to public health units to let them know that this has occurred. And there's also an update in terms of EpiPens and their availability. So we know that epinephrine, or the EpiPen adult, is currently on allocation from distributors, so at McKesson, McMahon. And right now the allocation is currently 2 EpiPen adults per pharmacy per week. And so that should meet the needs of anaphylaxis that would occur in your pharmacy following immunization. But it's really, really important to make sure that you keep an in-pharmacy supply of these EpiPens and that you don't accidentally dispense all of your remaining EpiPens. because you do need to have the EpiPens in stock, and you can only order 2 per week. So you might want to start ordering them now. You could do 2 this week, 2 next week, in anticipation of offering influenza vaccines. Now, in the past, when there's been a complete back order of vaccines, there have been alternatives that have become available and have been covered, but we don't seem to be at that stage yet, and we'll keep you updated if anything changes in that regard.
So now we're going to move on to the Ontario Influenza Immunization Program, followed by the Alberta.
So in Ontario, there have been some big changes this year. One of the really big changes was the addition of retirement homes as a location where pharmacists can give flu shots. So last year, some people might remember that if a patient was already a patient of your pharmacy and they required a flu shot but could not come into your pharmacy due to a physical or mental reason that made them incapable of coming in, similar to a home meds check, then the pharmacist could go and give the flu vaccine. Well, this year, it's really been expanded so that pharmacists can give flu shots to anyone in a retirement home, even if they're not patients at their pharmacy, and even if they could make it to a pharmacy. There are 2 things that must be met, 2 criteria that must be met, however. The first is that the public health unit of the pharmacy must be the same public health unit that the retirement home belongs to. And so one way to find this out is by looking online on Public Health Ontario's website on their health services locator map. So using this map, you're able to search the name of the retirement home, and it'll come up as a dot on the map. And then you can see the boundaries of the public health unit that surround this retirement home address. You can even click on the name of the public health unit, which we've done here, and it'll let you know what name the public health unit has for that retirement home. You can then search your own pharmacy in the same application and click on the public health unit that you fall into. And so if the public health unit of your pharmacy matches the public health unit of the retirement home, that would be a location you'd be allowed to go administer influenza vaccines in. Now, the second criteria is really making sure that it is, in fact, a retirement home. So there's a difference between long-term care homes and retirement homes. Pharmacists, community pharmacists, can only go to retirement homes to administer these vaccines. And so one way to find this is by looking at the Retirement Home Public Register, and it's a list of the over 700 licensed retirement homes across Ontario. And so you can type in either the name or the city and find the retirement home that you're looking for to confirm if it is a retirement home. If it's not a retirement home, it won't be one that you can locate on this register.
We do have a question regarding whether or not you can administer vaccines to those within group homes, and another question about in schools. And so the answer is no, not at this point, not unless they are patients of your pharmacy. In that case, they would come to your pharmacy to get the vaccine. If, for example, they're in a group home and they meet the requirements of not being able to come into your pharmacy, then in that instance, you would be able to, as long as they're your patient. But this new regulation is only for retirement homes, and they don't have to be your patients in the retirement home. But for any other, for example, nursing home, group home, hospital, this doesn't apply. So good question.
Okay, so one of the other really big changes that came this year was in terms of distribution. So for people who have pharmacies in the postal code M, nicely nothing has changed. So you still order your vaccines through the government pharmacy program. For people in postal codes K, L, N, and P, vaccine distribution has been consolidated to only 2 distributors. So that will be Shoppers Drug Mart for Shoppers Drug Mart pharmacies, and McKesson for all other pharmacies. So that includes people who are in a McKesson banner, as well as people who are not part of a McKesson banner. So independent pharmacies like Whole Health Pharmacies will now receive their influenza vaccines from McKesson. Now, in terms of ordering vaccines, we'll go through the actual order forms in a bit, but to find out how many you're allowed to order, returning UIIP pharmacies have been allowed to order a maximum of 40% of last year's administered doses. So if your pharmacy did, for example, 1,000 influenza vaccines last year, your maximum initial order would be 400. If you're a new pharmacy to the UIP program, your maximum is automatically assigned as 5 units, which represents 50 doses. So 1 unit is 50 influenza doses.
The replenishment orders, now this is it may be a bit tricky for you to understand, but the whole point of it is so that they're trying to reduce the wastage of vaccines, which makes sense. So this works based on how many vaccines you bill. So in November, if you're trying to order more vaccines, they're going to look to see from the initial quantity that they gave you, how many of those have you billed? Because the build relates to how many you've administered, which tells them how many you have left in your pharmacy. So like Tiana said, if you have, let's say, 400 vaccines and you want to order more, then you need to be less than 200. You need to have less than 200 vaccines in December. And that will allow you to order more. And the same applies in December. You need to have 20%, less than 20%, January 10%, February 5%, and March 5%. And again, this is all to prevent wastage. You shouldn't need to order more vaccines if you still have more than 50% of what they've sent you remaining. We did have a question about whether, so for a new pharmacy, for example, if you needed to order more vaccine, maybe 50 isn't enough, for example. Or, this wasn't part of the question, I'm just adding to it because this has happened in the past, but there have been pharmacies who have grown quite significantly from the previous year, and they're wondering, well, last year I did 100 flu shots, but this year I'm expected to do 300. So I know that typically the wholesaler will account for growth, but I've grown a lot. So this will typically in the past has been done on a case-by-case basis. Of course, the wholesaler will look to see how many you've billed. And so if you truly have billed all your vaccines, let's say you're a new pharmacy and you've gone through your 50 units quite quickly, then in the past what we've done is that, you can communicate with the wholesaler and they should be able to give you more depending also on how much stock they have, what the ministry has sent them. So there's been no communication about that yet. This is just based on experience from previous years. But it's safe to say that if you need more vaccine and there is vaccine available from the ministry, then the wholesaler should be able to send it to you as long as you demonstrate that you actually have a need for it.
Yeah, and so that really exemplifies why it's so important to make sure that your billing is up to date. I know it can get very busy during flu season and it can be easy for the paperwork to kind of pile up, but the time period checks will be every Thursday. So they'll go in and see how many vaccines your pharmacy has billed for as of the Thursday of every week. And if you do meet the acceptable remaining doses percentage, then additional vaccines will be given to you. So if you have to make sure you stay late on Wednesday or get those in time for Thursday, because if you don't, unfortunately, you'll have to wait until next week, next Thursday, for them to reassess and give you more vaccines. And we wouldn't want you to run out for the week because of a simple billing issue.
So moving on to the government pharmacy form. So this applies for those within the M postal code. As previous years, everything is done with relation to the local public health unit. So the communication has nothing to do with the wholesalers. It's between your local public health unit and the pharmacy. And this can vary from public health unit to public health unit, depends which region you're in within the M postal code. So the process may vary, but that being said, there is one form. And this form it seems to be not just for pharmacy. And the reason why we say that is because there's a a line item here on number 2 where it says influenza vaccine order that says you can order the high dose trivalent. That is not the case for pharmacies. So if you're filling this out, be sure to ignore that column, or sorry, that row rather. But the rest of the information is there. If you need to order your quadrivalent vaccine, it's all under one row. You can't choose which vaccine you're getting. You just simply write the number of doses that you have on hand and the number of doses that you require for the order, and then send that into the public unit by fax. And the number is on the form as well as on our slideshow here.
And we haven't yet received communication in terms of when initial orders or replenishment orders will be accepted. And this might vary, like Salima said, by public health unit to public health unit. So the best place is really to go to them and find out what they expect in terms of timelines. Okay, now for the forms that are a bit different than previously, we have the McKesson forms. So most pharmacies, or all pharmacies who are new to this process and who do not have an existing McKesson account, would have already received a fax from McKesson. If you haven't received a fax from McKesson, you do need to email ontarioflu@mckesson.ca to let them know you haven't received these forms. And you should CC Ken, so K-E-N, at wholehealthrx.ca if you're within the Whole Health banner, and he'll ensure that it's addressed or escalated if needed. And so the reason why you need these forms is because the first form is for ordering your initial supply. So on this form, if you're new to McKesson, it will indicate what your McKesson account number is. It just has been blanked out here. And it'll also indicate what your maximum initial order is. So again, that 40% of last year's administered vaccines. So for example, it might say 15 here. Again, a reminder that 15 units corresponds to 150 doses. Now on the second page, you'll be able to fill out the number of vaccines you'd like to order for your initial order. So it could be the full maximum that they indicated on the first page, or it could be a lower number if for some reason you think you might have less patients that you immunize this year. Once you complete this form by including your account number and your name and your initial order, you can return it by fax to the number here, and this must be done before October 10th. So if you haven't yet done it, do fax your pharmacy today, because they will start reviewing the forms tomorrow to start inputting the data on initial orders. And one thing that you'll notice is that, like Salima said for the government pharmacy forms, is that the influenza McKesson number will be the same for all of the quadrivalent vaccines that will be available in pharmacy. So by just having the number on the form, that will then tell them to send you influenza vaccines, but you won't be able to pick specifically which one. So that's McKesson item number 114956. Now, the second part of this fax will be your Pharmaclik user agreement form. So this is to set up your Pharmaclik account, which you'll use for replenishment orders later on in the flu season. So by filling out this form and agreeing to it and refaxing it in, you'll be sent a username and temporary password for Pharmaclik. And that should happen in about 2 to 3 business days once it's been received. And they might start reviewing them again October 11th. So anticipate something maybe around Tuesday, Wednesday of next week. If you haven't heard from McKesson with your Pharmaclik information by this time, again, it's important to email McKesson and CC Ken, and we will follow up to ensure that your account is created. One thing to note for people who are newer to McKesson accounts and Pharmaclik ordering is that your Pharmaclik password likely expires in about 2 to 3 months. So you will get a prompt every 2 to 3 months to reset your password. So keep an eye out for that.
We wanted to show you what the Pharmaclik ordering site would look like for those of you who have not used McKesson before. So as you won't see this right now because right now you'll be ordering your initial vaccines via fax. But moving forward for your replenishment orders, you will have to use Pharmaclik, and we wanted to show you what that would look like. So as Tiana said, you would enter in the item number for the flu vaccines, which is 114956, and then that would bring you to Ontario Ministry of Health quadrivalent inactivated vaccine, and then you would put your quantity in there. Right now, it's not available because it's too early at this point, but we just wanted to show you what this would look like just so that you could see it before they sent you your login details. You won't be able to order any other products if McKesson is not your wholesaler, just this one.
And for those of you who already have a McKesson account, you should be able to log into Pharmaclik and order vaccines. And to the best of our understanding, your initial order is also due October 10th. So do log into Pharmaclik and see if you're able to order vaccines. If you're not, again, follow up with McKesson and CC Ken. Now this slide here is just an overview of the timelines for the McKesson process. Again, a reminder to fax in your Pharmaclik user agreement and your initial vaccine order, or place your initial vaccine order if you're an existing McKesson account. And to do that as soon as possible, ideally before October 10th, since October 10th is the deadline. Vaccines will then be shipped sometime between October 21st and November 1st, with an anticipated start date of November 1st for the UIIP program. And then replenishment orders will start being placed starting November 4th and continuing on until the March timeframe. And the last part we wanted to really emphasize is the vaccine return process. So although you're ordering from McKesson, you actually return any unused or expired vaccines to your local public health unit. And this might occur, for example, when you're using a multi-dose vial, because they only have a 28-day shelf life once it's been opened, even when kept in the fridge. If not all of the doses have been used in that time frame, you will have to return the vaccine for destruction to the public health unit.
Now we're going to move on to the Alberta Influenza Program, and this is a much simpler program. It's the same as last year. Distribution is done through the wholesalers. You have a maximum initial order of 200 doses, which is 20 units, and then any unused vaccine products will go directly back to the wholesaler. And their vaccine program begins the week of October 21st. So it's very similar to last year. If you have any questions about that, feel free to reach out to us. But it should be fairly straightforward, unlike the Ontario program. Now we're going to talk about Whole Health Flu Program, and we have some really nice additions this year, which we're excited to show you. So the first one are our posters. So these posters are all about protecting your whole family and really encouraging patients to not only get the flu shot for themselves, but for the rest of their family members as well. And when it comes to family, what we've done is we've expanded the representation of what a family is from our first posters to what they are now. So you'll see different family types, different abilities, different ethnicities. You'll see a lot of different great posters which may represent the people in your community. We also have 13 different languages. So if there is a poster that you want, we probably have the language for it. So feel free to reach out to us if you haven't received it already, and we will make sure that that's available to you. These will also be found on the partners portal if you wanted to download them as well. So we hope that these match many of your community members and that they appreciate the posters as well.
Yeah, and so of those 13 languages, we have available posters in Arabic, Chinese, English, French, German, Italian, Persian, Portuguese, Punjabi, Romanian, Spanish, Tamil, and Urdu. So a lot of different languages represented, and we thank the pharmacists who helped us create those languages. And if you find that your patient preferred language isn't available, reach out to us. We're always looking to add on what we can offer to meet the needs of our diverse patients.
Okay, so we are going to talk about just the different tools that we have in terms of education. So we've got a few different things that you can put in your pharmacy as well as online. We've got tent cards, brochures, bag stuffers, great countertop displays that you can put in your plastic acrylic signs. And then we've gone digital with social media content that you can share on your Facebook or Instagram pages, just to ensure that the reach of getting the flu shot expands beyond the four walls of your pharmacy to your patients who may use social media a bit more. And lastly, part of the Whole Health program, this was a first in Canada that Whole Health launched last year. As you can see, we were the champions of innovation. We were on several different news platforms, including CBC, National Post. Many of our pharmacists were featured in their local newspapers or radios or television shows. So we got a lot of great feedback on this program. And the great thing was that at first we had launched it for kids to help them be more responsive to getting a flu shot and help them have a better experience when it comes to flu. Because as you can see, the little girl and not really noticing that she's getting a flu vaccine. What we also noticed is that even the adult patients really liked having this feature. So, you know, you've got your senior patients who are really excited to be underwater or something like that. And so it's a really nice way to bring some innovation into your pharmacy and encourage more flu vaccinations within that. So if you wanted to take part in that program, we do have a bunch of new playlists as well. We've got underwater, skydiving, roller coasters, some cartoon images. So we've expanded that as well. How it would work is you would purchase your VR headset and we could send you the link to do that. And we can also, it should be self-explanatory to set up, but if you need any help, we're here for you. All of our videos are on our Whole Health Pharmacy Partners YouTube page, so you'll find our playlist there. And all you have to do is select the VR icon on your mobile phone, insert the phone into the headset, and then there you go, put that on the patient and vaccinate. So it's fairly straightforward and a nice little tool.
Yeah, and I think this year with flu myths not being available anywhere in Canada, that's including in pharmacies as well as in primary care physicians or nurse practitioners' office. This really is an opportunity for finding ways to reduce the pain and fear associated with needles, since that nasal spray option won't be available. So having VR, I think, can really help increase uptake of the flu vaccine and keep your patients protected.
If you are doing VR this year and you didn't do it last year, be sure to let us know. We have a website that allows patients to find your pharmacy. So just email us and we'll add you to our website, and then patients can look up through here where the closest Whole Health pharmacy that's offering virtual reality is.
So we've included some summary points here, since we did talk quite a bit about changes to the program this year. The first point is really that the flu season is anticipated to be particularly bad this year. So really do have those conversations with patients, especially those who are at high risk of complications, about getting their flu shot. The second one is that you can really do outreach and immunize retirement home residents this year, even if they're not part of your regular patient roster. Feel free to reach out to retirement homes within your local public health unit boundaries, so that you can help keep them protected as well and make a good relationship with the residents of that retirement home. Just make sure to check that it is a retirement home and again is within the public health unit boundaries of your pharmacy. The next thing for Ontario pharmacies, those of you outside postal code M, is that the distribution process is different, and so you will be ordering from McKesson. So make sure you get your initial vaccine orders in, be that through a vaccine order form that needs to be faxed in if you're a new McKesson customer, or by placing your order through Pharmaclik if you're an existing McKesson customer by October 10th. And make sure you send in your Pharmaclik agreement as well, and keep an eye out for your username and temporary login information early next week. The next point is that Whole Health really has embraced diversity in our influenza posters, and we have various demographics and patient populations represented with 13 different languages for you to choose from. So feel free to put those up. We've sent them all out, so everyone should have received a tube with their posters if you're part of the banner. And that's according to the demographics that you submitted in your survey about the flu. If there are other patient demographics or languages that you'd like, you can visit the partners portal to download and print them, or you can contact us and we can print them and send them to you, or work on developing additional languages and representation for future years. And our last point is that Whole Health is continuing to offer the virtual reality experiences. So like Salima said, if you have any issues ordering your VR headset, or if you want to let us know that you're now offering this experience so that we can update our website, just email myself at Tiana, so Tiana @wholehealthrx.ca.
And that brings us to the end of our webinar. We really want to thank you for joining us. We do have a list of resources which will be sent out to our members via the slides. So be sure to check out those links there if you want any more information. Also, Ken and Tiana's emails are at the bottom. Of course, if you have any wholesale questions, please send them to Ken, and any program-related questions, do send them to Tiana.
Yeah, and so all pharmacies should have now received their hard copy flu materials as well as their flu posters. And additional copies and materials can be accessed on the Partners portal. If you have any issues accessing the Partners portal or finding the influenza materials once they're uploaded, which is likely early next week, then do send an email to us and we'll ensure that we get you set up.
Okay, well, thank you so much for joining us. And if you have any questions, please feel free to reach out to us at any point. And we wish you a really successful flu vaccination program, and all the best.
Yeah, thank you so much.